Aloe vera, sometimes described as a wonder plant, is a short-stemmed shrub. Aloe is a genus that contains more than 500 species of flowering succulent plants. Many aloes occur naturally in North Africa. The leaves of aloe vera are succulent, erect, and form a dense rosette. Many uses are made of the gel obtained from the plant's leaves. Aloe vera has been the subject of much scientific study over the last few years, regarding several claimed therapeutic properties. In this article, we will look at some of these claims and investigate the research behind them. What is aloe vera? Aloe vera gel has many medicinal properties and is often used in creams and lotions. According to Kew Gardens, England's Royal Botanical Centre of Excellence, aloe vera has been used for centuries and is currently more popular than ever. It is cultivated worldwide, primarily as a crop for aloe gel, which comes from the leaf. Aloe vera is widely used today in food. It is approved by the FDA as a flavoring. Cosmetics. Food supplements. Herbal remedies. The earliest record of a human use for aloe vera comes from the Ebers Papyrus, an Egyptian medical record, from the 16th century BC. According to a study published in the Indian Journal of Dermatology, in ancient Egypt, they called aloe vera, that plant of immortality. The authors added that the plant has been used therapeutically for many centuries in China, Japan, India, Greece, Egypt, Mexico, and Japan. Benefits. The medicinal claims made about aloe vera, as with many herbs and plants, are endless. Some are backed by rigorous scientific studies while others are not. This article focuses mainly on those that are backed by research. 1. Teeth and gums. A study published in General Dentistry reported that aloe vera in tooth gels is as effective as toothpaste in fighting cavities. The researchers compared the germ-fighting ability of an aloe vera tooth gel with two popular toothpastes. They found that the gel was just as good, and in some cases even better than the commercial toothpastes at controlling cavity-causing oral bacteria. The authors explain that aloe latex contains anthraquinones, compounds that actively heal and reduce pain through natural anti-inflammatory effects. The scientists warned that not all gels they analyzed contained the proper form of aloe vera. They must contain the stabilized gel that exists in the center of the plant to be effective. 2. Constipation. Germany's regulatory agency for herbs, Commission E, approved the use of aloe vera for the treatment of constipation. Dosages of 50 to 200 milligrams of aloe latex are commonly taken in liquid or capsule form once daily for up to 10 days. The U.S. Food and Drug Administration (FDA) ruled in 2002 that there is not enough data on the safety and efficacy of aloe products, so, in the U.S., they cannot be sold to treat constipation. 3. Diabetes-induced foot ulcers. A study carried out at the Sinhgad College of Pharmacy, India, and published in the International Wound Journal looked at aloe's ability to treat ulcers. They reported that a gel formed with carbopol 974P 1% and aloe vera promotes significant wound healing and closure in diabetic rats compared with the commercial product and provides a promising product to be used in diabetes-induced foot ulcers. 4. Antioxidant and possible antimicrobial properties. Aloe vera may be used on skin conditions or superficial cuts for its antimicrobial and antioxidant properties. Researchers at the University of Las Palmas de Gran Canaria, Spain, published a study in the journal Molecules. The team set out to determine whether the methanol extract of leaf skins and flowers of aloe vera might have beneficial effects on human health. The scientists focused on the extract's possible antioxidant and antimycoplasmic activities. Mycoplasma is a type of bacteria that lack a cell wall. They are unaffected by many common antibiotics. Antimycoplasmic substances destroy these bacteria. They reported that both aloe vera flower and leaf extracts had antioxidant properties, especially the leaf skin extract. The leaf skin extract also exhibited antimycoplasmic properties. The authors concluded that a. Vera extracts from leaf skin and flowers can be considered as good natural antioxidant sources. 5. Protection from ultraviolet (UV) irradiation. Scientists at Kyunghee University Global Campus, South Korea, wanted to determine whether baby aloe shoot extract and adult aloe shoot extract might have a protective effect on UVB-induced skin photoaging, in other words, whether they could protect the skin from the aging effects of sunlight. Baby aloe shoot extract (BA) comes from 1-month-old shoots, while adult aloe shoot extract (A) comes from 4-month-old shoots. In an article published in Phytotherapy Research, the authors concluded, our results suggest that BA may potentially protect the skin from UVB-induced damage more than A. 6. Protection from skin damage after radiation therapy. A study carried out at the University of Naples, Italy, tested 5 different topical creams to see how effective they might be in protecting the skin of breast cancer patients receiving radiation therapy. One of these creams contained aloe. They divided 100 patients into 5 groups of 20, each was prescribed a different topical treatment. They applied the creams twice daily, starting 15 days before radiation therapy treatment, and carried on for 1 month afterward. During the 6-week period, the participants underwent weekly skin assessments. In the journal Radiation Oncology, the scientists reported that the preventive use of the topical hydrating creams reduced the incidence of skin side effects in the women treated with radiation therapy for breast cancer. None performed significantly better. All moisturizing creams used in this study were equally valid in the treatment of skin damage induced by radiotherapy. 7. Depression, learning, and memory. An animal experiment. A study published in Nutritional Neuroscience found that aloe vera reduced depression and improved memory in mice. After carrying out experiments on laboratory mice, they concluded aloe vera enhances learning and memory, and also alleviates depression in mice. Further studies are needed to establish whether humans might also receive the same benefits. 8. Wounds from second-degree burns. A team of plastic surgeons compared aloe vera gel to 1% silver sulfadiazine cream for the treatment of second-degree burn wounds. They reported in the Journal of Pakistan Medical Association that the burn wounds among the patients treated with aloe vera healed significantly quicker compared with those treated with 1% silver sulfadiazine (SSD). The researchers added that those in the aloe vera group experienced significantly more and earlier pain relief than those in the SSD group. The authors wrote, thermal burns patients dressed with aloe vera gel showed advantage compared to those dressed with SSD regarding early wound epithelialization, earlier pain relief, and cost-effectiveness. 9. Irritable bowel syndrome (IBS). A randomized, double-blind human trial carried out at St George's Hospital Medical School, London, United Kingdom investigated aloe and IBS. Their results were published in the International Journal of Clinical Practice. Participants with IBS were given either aloe vera or a placebo. After 3 months, there were no significant differences in symptoms of diarrhea. However, the researchers wrote, there was no evidence that aloe vera benefits patients with IBS. However, we could not rule out the possibility that improvement occurred in patients with diarrhea or alternating IBS whilst taking Avenue. Further investigations are warranted in patients with diarrhea predominant IBS, in a less complex group of patients.